Physiological pain portals and hydrozone for prolapsed disc with sciatica. Slip disc with sciatica and low backache treated with hydrozone is being displayed in this video. Physiological portal blocks are injection of Chennai cocktail into specific spots for many conditions. Hydrozone is a combination of 99.99% pure hydrogen with molecular ozone. Combination of hydrogen and ozone produces excellent results in many conditions including discs and sciatica which do not need surgery. The formula for Chennai cocktail for pain portal blocks is 2 cc of 2% xylocaine, 30 micrograms of clonidine, a dash of quinacot and 12 mg of distilled water. This makes a pentadiluted cocktail. The case is a 25-year-old patient with severe low back and sciatica of MRI proven slip disc at 2 levels, L4, 5 and L5, 1, advised surgery by 7 doctors, orthopedic surgeons and neurosurgeons. SLR extremely diminished, severe low back pain and a visible clinical sciatic scoliosis. We gave beta 1, 2, 3, 4, 5A with tau 4, 5 portals and that was the initial planning. The MRI of the patient is shown subsequently and I would like to emphasize here that most people want to operate on basis of MRI rather than treating the patient properly. He does have major massive disc bulges on 2 levels which are symptomatically correlated, but this does not need a surgery. The sciatic scoliosis of the patient indicates specific spasm of the intervertebral muscles because of constant irritation and pain. We can see the bent back of the patient causing painful spastic scoliosis. He also had a hamstring spasm. The straight leg raise of the patient was extremely painful and here we can see a demonstration of what he is able to achieve before the blocks. His hamstring is extremely tight, he needs to flex his knee to go beyond little level. You can see the facial expression of the patient and he says yes, it's impossible for him to raise beyond it and the knee gets tight and stiff, and when he tries to keep his knee straight and raises he gets pain and maybe at 50 degrees he is wincing. I hold his knees, ask him to hold his belly and ask to sit up and he feels that there he complains of pain. So that is how bad he was. For blocks we need to lay the patient prone and clean the spots of the block. So here we are cleaning the spots of tau 4, tau 5, beta 5, beta 5A and beta 1, 2 and 3. Every spot will get only 1 ml of cocktail. 20 cc syringe is connected to a bivalve and a leak test is done. This is essential for the hydrogen part. So, we are opening a bivalve and connecting it to a 20 cc syringe. Hydrogen does not damage latex, so a standard 20 cc syringe can be used for molecular hydrogen. We can see we are connecting the bivalve, closed bivalve to a syringe, and a leak test is performed by checking that when we press, no air escapes. This syringe is now attached to the hydrogen machine outflow so that the syringe is filled with hydrogen. The syringe is kept upside down because hydrogen is lighter than air, and so from an upside down syringe hydrogen will not and shall not escape. Once the hydrogen is extracted, the closed bivalve is attached to the syringe so that the hydrogen will not escape. Here hydrogen is being extracted, attached to a bivalve, and then tested for leaking. We can see that hydrogen does not compress and come back. In an ozone compatible syringe, ozone is extracted and attached to a three-way cannula. So here we are extracting ozone at a concentration of 70 to 100 microgram percent or 70 to 100 gamma is extracted in a syringe. We can extract as much of ozone or hydrogen as we require. Only the desired amount suitable for that particular patient or subject shall be injected into him or her. Now the other end of the bivalve is attached to the syringe, and this right angle assembly with the sealed gases is kept separately. The ozone machine is closed and cocktail is now mixed. We need to change the needle after mixing the cocktail so that the patient gets a fresh needle for most of his injections. The right angled syringe combination is held by the nurse while a fresh syringe is taken. We take first just 1.5 to 2 milliliters of 2% xylocaine. To this we add 5 milligrams of Kinacot, which is just 1/4 of what the vial comes with, and this is mixed with clonidine. The ampule contains 150 micrograms, we need just 30 micrograms. So 0.2 milliliters of clonidine is extracted, as I call it, dip the beak. This is now diluted with 10 to 12 ml of distilled water. Normal saline is not to be used. So we are extracting 10 to 12 ml, and now we have a dilute Chennai cocktail, which is what is going to be used as part 1 of our block injections. Pain portal blocks or physiological portal blocks of Chennai cocktail depend on hexadilution or pentadilution of xylocaine, meaning xylocaine diluted heavily. A fresh needle is attached, and these are the two components needed, one with cocktail and one with the gases. Each portal is injected first with cocktail the syringe is removed and then the dual syringe assembly is attached through which the gases are given in the sequence. After injection of cocktail, the needle has to be left in place and we first inject a dash of ozone, then inject the hydrogen and lock the bivalve to prevent the escape of hydrogen. The same can be repeated or is repeated with every portal one by one. First a dash of ozone, then the bivalve twisted, the prerequisite amount of hydrogen and the part rubbed. So, we have done tau 4, now is tau 5, we have changed the needle again. It is recommended that the needles are frequently changed so that the sharp needles do not cause much pain to the patient. Steps are the same. Cocktail first, leave the needle in the place, inject appropriate volumes of ozone and hydrogen. After injecting hydrogen, we have to close the bivalve to prevent the escape of hydrogen, which is a very naughty gas, lighter than air, and will escape easily. We use the gaseous addition only to tau blocks and beta 5 blocks which have enough space. For other blocks where the space is less, we do not use either hydrogen or ozone. Now, the remaining portals are injected without the use of hydrozone. These are the characteristic beta 1, 2 and 3 portals which have made the physiological pain portals extremely impressive and also made the system gain recognition nationally and internationally to such an extent that over 2000 practitioners are practicing. Once all the portals are injected, a routine major autohemotherapy is given. An MAHT is mixing of the patient's blood with 70 to 100 micrograms per ml of ozone. Heparin is first extracted into a bottle and we are using 1000 units per ml. So, 5 ml will contain 5000 units. This 5000 units has to go into the heparin bottle. The MAHT bottle is a vacuitainer bottle which has its own vacuum. The syringe is pushed and the heparin is allowed to be sucked in on its own. There it is. We have to pull it out with the needle. Then we open another 5 ml of heparin bottle containing 1000 microgram per ml of heparin, and this is 5 ml, 4 ml is used to prime the set, while 1 ml is used to prime the butterfly. We do not use routine latex rubber containing or other non-ozone compatible transfusion sets. The interior of the set is coated with heparin as it pushes down the transfusion set. Once the solution reaches the bulb, we stop and a butterfly is opened. The last 1 ml of the heparin is put into the butterfly. We wait till it drops out, and then the butterfly is tightly connected to the transfusion set. The set is passed across an ultraviolet hanging system, and a vein is identified. The patient is a little obese because of his steroid intake, and thus getting a vein was difficult. Once the vein is located, the drip set is pushed into the bottle, the flow is started, and against gravity the blood will flow gradually into the bottle. If the vein was patent and big, the blood would have flown in larger quantities and gushed. Here it is a small vein, so the blood is coming in slowly. Both the interior of the set and the bottle are heparinized to ensure that there is no clotting. We now set the regulator at 80 micrograms per cent of ozone concentration, and using a 50 milliliter syringe, ozone compatible syringe, appropriate volumes of ozone are withdrawn. Here I am attempting to withdraw 60 ml of ozone of 80 microgram per cent concentration, or 85 micrograms, which will give me a per patient per session dose of 60 into 80 is 5000 gamma or 5000 microgram of ozone. A needle is attached, bent to 90 degrees, and the same is now pushed into the bottle. At the plus sign, as it gets drawn and the blood gets ozonized and turns cherry red or tomato red. Air vent, if any, is pushed out, and if there is an air column accidentally coming into the vein, then we can close the transfusion set and attach a bivalve to the patient butterfly, and when the air column reaches, the bivalve is opened and the air is let out into the betadine bowl, and once the free flow comes, we can let the rest of the blood go back into the body. you could see that the infusion blood was dark violet in color, while the retransfusion blood is tomato red or cherry red in color. This is because of high dose ozonization, which has detoxified and purified the blood, and also due to the ultraviolet irradiation of the correct wavelength, which has made the blood so red. Once the transfusion is over, the MAHT set is plugged out of the bottle and the remaining remaining blood is allowed to drain into the patient. The butterfly is then removed, a good padding is applied, and the patient is instructed not to remove the padding for 4 hours because we have used heparin and we do not want any clots. So, a padding is made ready, the butterfly is removed, the padding is applied and tightened, and then an elastic bandage is used to ensure that the patient does not bleed from the MAHT site. He is instructed not to remove the bandage, and then we can do a straight leg raise of the patient to see how effective or how good he is. We can see the smiling patient who has never been able to raise his legs so high. He has no hamstring spasm, his back pain has gone, and the tight hamstrings have become loose. He is sitting upon his own and he says that he feels 95% relieved. As I am giving this audio, I have to keep his video muted, but then I asked him to stand up, walk, and then wanted to take a photograph of his back to see the status of his sciatic scoliosis. The topmost endoscopic surgeon in the country had advised him that unless you do surgery, your back will not become alright. And here we have a bent back which has become straight with IAOS advanced methodology of blocks and hydrozone. So, you can see how well the results are. If you are a medical practitioner and want to learn these techniques, please message me in WhatsApp. Calls are not entertained. This number 97910200615. You can message and I will be happy to send you details about this course. Thank you very much. Have a nice day. Thank you.